Deep brain stimulation is a way to treat parts of the brain that cause Parkinson's disease and other movement disorders. Dr. Sarah Pirio-Richardson and Eric Marchand from UNM's Department of Neurology join us this morning with more information. Good morning. Welcome to the new Tukasa Style.
Thanks.
Yeah, thanks for being here. Okay, so I'm wondering if you can tell us a little bit about what various movement disorders y'all treat.
Sure, yeah, I can tell you a little bit about movement disorders. So they're disorders that involve tremors, difficulty with balance, and slowness of movement. So people have difficulty doing everyday things like buttoning. Okay. So diseases like Parkinson's disease and tremor are diseases that you can treat with surgery.
Okay. Okay, and I'm wondering, so y'all do the deep brain stimulation. Now, is this a new form of treatment? Is this something it's fairly new?
It's relatively new.
Okay.
It was started to be used experimentally probably 20 years ago, but has been an approved treatment for now almost 10 years.
About 10 years, okay.
And for a limited number of movement disorders.
Okay.
And it's still under investigation for treatment of other conditions as well.
Really? Okay. Now, can you tell us a little bit about who would be a good candidate for this type of treatment?
Most of the people that are treated are Parkinson's disease.
Okay.
People used to be reserved for people who were very disabled, but it's been shown to be so effective and safe that it's being used for people much earlier in the course of their degenerative disease.
Okay.
So that these are the people that are being treated more today. These are people who have a good response to medication, but maybe problems with their medications, and people who pass neuropsychological testing to see that the treatment won't likely impair them in other ways, because these are possible side effects of the treatment.
Okay, okay, that's good to know. Well, you know, when I hear deep brain treatment, it's a little scary. So can you tell us what exactly is the procedure? How is it performed?
It's done in two parts typically. Some places even do it in three. The first part is done with the patient awake, and it involves imaging with MRI scan and CT scan to localize one of the three typical targets in the brain that we use for stimulation. And the patient then has a device affixed to the head to guide an electrode very accurately to the chosen target down a chosen path that avoids blood vessels and other anatomical areas in the brain to minimize side effects. And so we pass first a very tiny electrode, and then Dr. Pirio-Richardson's in the operating room with me, and she interprets the neuronal firing patterns that we record, and we identify our target area.
Okay.
Then this is all done with the patient awake and with local anesthesia. It's quite an experience for them typically.
I bet, yeah, to say the least.
And then they're hearing their own brain at work.
Oh my goodness.
Because this is a lot of audio involved, as well as looking at waveforms on a screen.
Okay.
And
now, they go through this procedure. What sort of results can they expect, both immediate and maybe a prolonged results? What happens after the procedure is done?
So the things that we expect coming out of the procedure is that, for instance, in Parkinson's disease, the tremor will be better controlled, that they'll have less tremor. And again, that even though they do respond to medications, the difficulty and what makes people a good candidate is they have such fluctuations, and this really evens out their day, so they're able to get back to doing the things that they want to do.
And the Department of Neurology is doing a lot in advancing this, is that correct? The procedure?
well, we have a team, and it includes not only Dr. Pirio-Richardson and myself, but her associate, Dr. Delictish, another neurologist, and then we have neuropsychologists who are involved, and we work with anesthesiologists and radiology to get all the information we need to do this. So it's kind of a big show to put together. We put the show together about twice a month.
Wow. Okay.
So we're doing 2 Mondays a month we've dedicated to this to these procedures.
That's great. Now, how can viewers learn a little more about what you guys are doing if they want to get in touch with you? Maybe they've got a loved one that they're considering this procedure with.
Our contact is through the University of New Mexico Departments of Neurology and Neurosurgery, but I don't think we have much online information. The National Parkinson's Foundation and the NIH would be sources of online information.
Great. All right. Well, thank you guys so much. Thank you for all the work that you do, and hopefully someone can get a hold of you if they need to get this to someone that they love. All right.